Hi, this is Dr. Pandey. Welcomes you all to the Health Awareness video program. In our previous video program, we have seen the hyperparathyroidism, clinical features and symptoms. In today's video program, let's have a glimpse of hyperparathyroidism diagnosis. The word hyperparathyroidism means increased parathyroid hormone levels. The word hyper means high and the word hypo means low. Now, before proceeding further, for the hyperparathyroidism diagnosis, let's have a quick glimpse of parathyroid hormone secretion. This is a thyroid gland, and thyroid gland has two lobes, one isthmus. Each lobe of the thyroid gland has two pairs of parathyroid glands. Now, these parathyroid glands are located posterior to the thyroid gland, that is the backside of the thyroid gland. Now, the upper lobe parathyroid glands are called as superior parathyroid glands and the lower lobe parathyroid glands called as inferior parathyroid glands. And the main function of this parathyroid glands is to secrete the parathyroid hormone. Now, these parathyroid glands are made up of oxyphil cell and chief cell. The main function of this cell is to secrete the parathyroid hormone. Now, in thyroid gland, apart from follicular cells, there is one more cell which is called parafollicular cell, which is squeezed between this follicular cells. Now, this parafollicular cell will secrete calcitonin. Now, whenever there is a low calcium levels in our body or in the blood, then the chief cells will secrete parathyroid hormone. So, low calcium level means hypocalcemia. Hypocalcemia is a prime responsible for parathyroid hormone secretion. Now, when there is a high calcium levels in the blood, then parafollicular cells will secrete calcitonin. High calcium level means hypercalcemia. So, hypercalcemia is prime responsible for calcitonin and hypocalcemia is prime responsible for parathyroid hormone secretion. Now, let's get into the hyperparathyroidism diagnosis. Before getting into this diagnosis part, there are few list of investigations which may help us to study the hyperparathyroidism. So, what are the list of investigations? One is parathyroid hormone profile or test. 2. Complete urine examination. 3. X-ray, or few places where been used as DEXA also. The DEXA means dual energetic X-ray absorptiometry. Apart from this, ultrasound, CT scan and MRI. So, these are the few list of investigations which may help us to study the hyperparathyroidism diagnosis. Now, the hyperparathyroidism diagnosis been divided into three parts. One is primary, secondary and tertiary. Now, in primary hyperparathyroidism, where the parathyroid glands itself been affected, which will secrete high parathyroid hormone levels. When there is a high parathyroid hormone levels, then the calcium reabsorption will also increase, which increases the phosphate. So, as the calcium levels increase, the phosphate levels should also increase. But we will see further whether how this phosphate level will decrease. Now, when the high parathyroid hormone levels in the kidneys will increase the active vitamin D levels. In the nephrons, where this is a proximal convoluted tubule, this is a distal convoluted tubule. In the proximal convoluted tubule, it will increase the activity of cyclic AMP. What is cyclic AMP? Is a cyclic adenosine monophosphate. It increases the level of adenosine monophosphate. Sorry. So what is the main function of this cyclic AMP? It secretes or reabsorbs the phosphate and sodium back into the cycle. But because the levels been increased, then it will block the channel. When the channel has been blocked, then the phosphate secretion will be reduced. When the phosphate secretion is reduced, then in the glomerular filtration, where the phosphate levels in the urine will increase. When the phosphate level in the urine has been increased, then the phosphate level in the blood will decrease. That is the reason why in phosphate levels in the blood will be low, whereas the phosphate levels in the blood will be, the urine will be high. Now, here in the distal convoluted tubule, where the reabsorption of the calcium will increase. So there will be high calcium levels. So in primary hyperparathyroidism, where we can see the high parathyroid hormone levels with high calcium levels in the blood with the low phosphate levels and high vitamin D, whereas in urine examination we can see high cyclic AMP levels with high phosphate levels and high calcium levels. Now let's get into the secondary hyperparathyroidism diagnosis, where in secondary hyperparathyroidism diagnosis the parathyroid glands will function normally. So there will be calcium reabsorption will be normal, okay, with the phosphate. Now in functions we have seen that in the secondary hyperparathyroidism we have taken an example of CKD, chronic kidney disease. When the kidney is not functioning properly, or then as we seen that the PTH will stimulate the activity of active vitamin D. So the vitamin D levels will be low. Then in the nephron, because the kidney is not functioning properly, so the nephrons will not function properly. So then proximal convoluted tubule, where the cyclic AMP levels will be low. When the cyclic AMP level is low, then the sodium and phosphate absorption will goes on. So there will be low phosphate levels. And the distal convoluted tubule, where this is also not performing its job. These two are not performing because the kidney is not functioning properly. So the calcium levels should also be, because the kidney is not functioning, it will give the information to parathyroid gland to secrete the high parathyroid hormone. So then the high parathyroid hormone will increase the calcium. Then it will be where the calcium in the nephrons will not be absorbed into the blood to increase the calcium level. So what will happen? The calcium level will be either normal or low, but in the urine the calcium levels will be high because it has been not absorbed. So with the high calcium levels in the urine. So this is a secondary hyperparathyroidism diagnosis. In tertiary hyperparathyroidism, where we know that it's if the secondary hyperparathyroidism continuously being prolonged, then it's automatically will shift into the tertiary hyperparathyroidism, where the parathyroid glands will increase their normal activity and they will be in the stage of hyperplasia or a risk of adenoma. Now when they are in the abnormal stage, then they will secrete the high parathyroid hormones. When they have been habituated to secrete the high parathyroid hormone levels, then the calcium levels will also increase with high phosphate levels. Now as we know that the secondary hyperparathyroidism has prolonged and shifted into tertiary. So the severe chronic kidney disease CKD will continue. So what it will do? There will be low vitamin D levels, and because the kidneys are not functioning properly, so the nephron will not function. So the cyclic AMP in the proximal convoluted tubule and the distal convoluted tubule, the secretions will not perform. So that will decrease the cyclic AMP level with decreased phosphate level and increased calcium levels. Why the increase of calcium levels here means where the body cannot absorb, because the parathyroid gland is releasing very heavy amount of parathyroid hormone, where the body may not be able to absorb the whole calcium which was being secreted. So then it will be released in the urine. That's the reason why where we can see in the tertiary hyperparathyroidism where there will be very high levels of calcium in the urine examination. So these are the few glimpses of hyperparathyroidism diagnosis. We will meet up with the next video related to parathyroid. Till then, thank you.